Welcome to our presentation on Transference Focused Psychotherapy by Deanna Kazin, Kate Gatow, and Tanya Wall. This presentation will go over what is Transference Focused Psychotherapy. We also have a brief overview of borderline personality disorder. We're going to talk about how Transference Focused Psychotherapy is used, who uses it, and what the research says about the therapy itself.
Transference Focused Therapy, an evidence-based psychotherapy used to treat people who struggle with personality disorders. Some of these disorders include anxiety, depression, and borderline personality disorder, also known as BPD. TFP is most often used to treat BPD.
While we start this presentation, we want to make sure that everyone understands what borderline personality disorder is, also referred to as BPD. BPD is a cluster B personality disorder. It is a pervasive pattern of instability of interpersonal relationships, self-image, and affects. It's marked by impulsivity that starts in early adulthood and is present in a variety of contexts. It is believed that BPD is a result of chaotic and dysfunctional relationships with caregivers as a child, that then creates a fractured representation of oneself in relation to other people and objects. And these dyads are categorized by one specific affect. People with BPD have an overactive amygdala and an underactive cortex. We feel it's important for you to understand that borderline personality disorder is very similar to bipolar disorder, and that both are marked by mood instability. However, in bipolar disorder, this is caused by lack of sleep and high levels of energy. In borderline personality disorder, you can often relate this back to a trigger or an incident that occurred in a relationship. We'd also like to go over the diagnostic criteria for BPD. A patient must exhibit 5 or more of the following: frantic efforts to avoid real or imagined abandonment, intense and fluctuating interpersonal relationships, lack of stable and internalized sense of self, persistent sense of emptiness or boredom, self-destructive or impulsive behavior in at least 2 different domains, like excessive spending or having sex in unprotected or with strangers, erratic moods that fluctuate between irritability, extreme dysphoria, and anxiety with episodes lasting from days to hours, intense anger or rage and difficulty controlling your temper, transient stress-related disassociation or paranoia, and self-harming behavior or suicidal ideation.
What is transference? The act of shifting emotions or expectations, usually unconsciously, from one person to another. Oftentimes, the experience or reactions are not applicable.
An example of this could be a therapist that's sitting with their client who makes a simple look at the clock to check where they're at in their session. The client often will take this as an act of unacceptance and wanting to escape the session, when the reality is the therapist is just trying to make sure that they don't go over so the next client is on time. So where did this treatment come from? Well, transference focused psychotherapy is based on Otto Kernberg's object relations model of borderline personality disorder. It's based on the core belief that a person's deep psychological makeup is fractured, which then leads to chaotic interpersonal relationships, self-destructive behaviors, and other BPD symptoms. A person with BPD often experiences trauma and intensely charged affects, which are then internalized and grouped together as a dyad. Each dyad exists separately from other dyads. Most often, positive and negative dyads are separated from each other and cannot coexist. The goal of transference focused psychotherapy is to merge the dyads to give the patient a whole and congruent experience.
How it's used. TFP has been shown to be useful in treating various forms of personality disorders, but was specifically designed for borderline personality disorder. TFP helps align the patient's thoughts and emotions to trauma to create a more desirable and healthy response. Therapists using TFP intentionally trigger patients in a clinical setting, then assist them in creating healthier responses to triggers. TFP helps clients respond more neutrally to other people. Therapists often join their clients in their triggered response so that client and therapist can observe the situation together from the patient's perspective. Treatment model. Therapist and client meet twice per week in a clinical setting to start. This reduces symptoms via behavior control, skill based teaching, therapist support, coaching, and guidance. One goal is to eventually work with the patients in a public setting to increase possible triggers so therapy can successfully be used outside of a clinical setting. To help patients identify the shifts in their own experiences and in their experiences with others to enhance their interpersonal relationships with people in their lives. Often divided into two phases: initial phase and longer phase. The treatment phases. The initial phase. This phase is in place to establish structure for treatment, which includes limit setting in regards to a patient's destructive behaviors. The longer phase. This phase includes exploration of the patient's mind and sense of identity. Both phases overlap and both continue throughout therapy.
To explain a little bit more about Transference Focused Therapy, we've included a link to an awesome video by Frank Yemen, and it is posted outside of this PowerPoint. This slide is to just show a small recap of the main points of the video. Transference Focused Therapy tries to merge thought and feelings so that a person can negotiate their reaction to environmental stimuli, helping clients experience the intense feelings that they experience during everyday life, then explore and understand how those feelings are triggered and the patient's responses while being present in the emotions with the client. A therapist plays two different roles during this type of therapy. First, they help the client to understand the perception of their emotions from an outsider's observations. Secondly, they help the client experience the emotions together with them and help them make sense of and understand their own emotions as they are experiencing a session together. The primary principles or interventions of trauma focused therapy um, are the following. One of the main focus of TFP is that it aims at the reduction of impulsivity. For example, aggression directed towards self or others, substance misuse, and eating disorders, mood stabilization, and the improvement of interpersonal relationships as well as occupational functioning. Based on the theoretical framework of Canberg, the treatment focuses on the integration of internalized experiences of dysfunctional early relationships to current experiences and how one reacts here and now. The three primary principles of trauma focused psychotherapy are exploration, confrontation, and interpretation. One example of exploration: a therapist can say to a client, "The therapy I think that would help most is where your role is to let me know everything that comes to your mind about the problems that brought you here without censoring or holding back. That could include the thoughts that emerge about me during a session. Now, this might sound easy, but it can also be tough to do. My role is to make every effort to understand things that go on in your mind that you're not aware, but that have an impact on what you feel, what you think, and what you do. In this type of therapy, my role is not to give you advice because my view of you is what you have the potential to grow in autonomy, and it would tend to leave you in a more dependent position if my role was to give advice. So, who uses transfer focused psychotherapy? TFP was designed to be used in the outpatient setting. However, research suggests that it can be effectively modified to be highly effective in an inpatient psychotherapy setting. Some of the professionals who use TFP include psychologists, psychotherapists, psychoanalysts, and social workers. Some of the populations that use TFP um, are the following. First of all, TFP integrates internalized experiences of dysfunction from childhood. In one 10-year follow up study, only 11% of those who achieved remission for BPD had a recurrence of symptoms. Younger age and a higher level of education consistently predicted better functioning. In random controlled trials that have been conducted, the main population has been between 18 and 55 with a diagnosis of borderline personality disorder. However, there has not been a limitation set on that age group, but transference focused therapy is not advisable for younger children and teenagers.
So, what does the research say about transference focused psychotherapy? Well, research says that transference focused psychotherapy is a controversial but empirically supported evidence based treatment. The first study that we focus on had 17 female patients who completed 1 year of transference focused psychotherapy. An analysis of functioning prior to treatment and 12 months into treatment showed significant decreases in suicidal behavior and significant decreases in psychiatric hospitalizations. While none of the females committed suicide while in the program and the treatment did not support decreased levels of self-harm. Another very important random control trial is one that was completed by Clarkin, and it had 90 patients who were randomly sorted into transference focused psychotherapy, DBT, and mentalization based treatment. The importance of this study showed that all of these forms of treatment showed effectiveness, but only transference focused psychotherapy and DBT showed signs of improvement in suicidality. TFP was the only therapy found to improve secure attachment and reflective capacity in interpersonal relationships. This is important because the goal of the therapist is to bring the client to a place where they have more secure and loving relationships. Another study also showed that TFP would be superior to basic talk therapy performed by community based psychotherapists. Community based psychotherapists are the most common type of therapist that a person with BPD would initially be seen, and it would be encouraging for them to have more opportunities to access transference focused psychotherapy.
Treatment goals of TFP. Some of the treatment goals are to reduce suicidality and self injurious behaviors, to increase affect regulation, to increase behavioral control, to increase the number of gratifying relationships, and to encourage client to pursue their life goals.
Below are some of the references that we've used while making this presentation. We feel like it's important for you to understand that there is a lot of room for growth when talking about transference focused psychotherapy. But the research done so far has shown that it's one of the most effective treatments when battling BPD. BPD has varied prognoses depending on how early somebody seeks treatment. Um, when you're talking about different treatment protocols, BPD is one of the most controversial because of the style of reflection and challenging that a therapist is using when it comes to a client and joining a client in their space rather than reflecting outwardly. It would be very helpful to see more information about the different populations that it's effective on and if there's differences between males or females or different age groups. Some of the most well-known uh, researchers in this topic are Clarkin, Levy, um, Yemens, and Kernberg. Other notable researchers are actually overseas in Sweden. We hope you enjoyed our presentation and have a good evening. We'll be adding a video by Frank Yemen under the presentation. If you have any questions, this is a great resource for you to be able to use to understand transference-based psychotherapy further.
Therapy also includes 1. Clarification of internal states, 2. Confrontation of contradictions that are observed, and 3. Interpretation that help explain the divisions and links between different states.